65 and you have Medicaid but not Medicare, or maybe you qualify for Medicaid and Medicare. In today's video, we're going to teach you the power of having both Medicare and Medicaid. If you qualify for both, we highly recommend that you get both. So in today's video, I wanted to talk about the power of having both Medicare and Medicaid. Some individuals actually qualify for both. And if you can get both, I highly recommend that you go ahead and get both. First, we're going to break this video into two parts: Medicare and Medicaid, the qualifications for both, how to get both, and the power of having both together. So let's start with what is Medicare. So Medicare is health insurance for individuals 65 and older, or if you have certain disabilities, okay? So how do you qualify for Medicare? So you actually earn Medicare by working. So if you worked in the US for 10 years, at least 40 quarters, then you could get on Medicare when you turn 65. Like I said, if you have enough working credits and you get Medicare from disability, you could get Medicare that way as well under age 65. So you still need to have enough working credits to qualify for Medicare under Social Security disability. Okay, now let's talk about the different parts of Medicare. What does Medicare actually covers? So you have your Medicare Part A, which is your hospital coverage, and you have your Medicare Part B, which is your medical coverage, okay? And then, of course, you also need drug coverage, which is going to be Medicare Part D, okay? So those are the basic parts of Medicare. We say Part A is just your hospital coverage, Part B is your medical coverage, and of course you need Part D, which is your prescription drug coverage, okay? So that is Medicare overall. Now there is a monthly premium when it comes to having Medicare Part B. You see, Medicare Part A, you paid that when you was paying Medicare taxes, okay? So that's why Medicare Part A has a $0 premium. However, Medicare Part B, there is a monthly premium, and most individuals would pay $174.70 in 2024. Now, once you go ahead and enroll in Medicare, you have two options. You could go on a Medicare supplement plan, or you could go on a Medicare Advantage. We won't dive into that in today's video. I have plenty other videos where I break down the difference between Medicare Advantage and Medicare Supplement. So definitely check out those videos. Today we're just going to focus on Medicare and Medicaid and the benefit of having both, okay? Now let's talk about Medicaid. So what is Medicaid? So Medicaid is health insurance as well, but the qualifications is a tad bit different. The qualifications is actually based on your income and limited resources, okay? So if you're low income and you have limited resources, then you may also qualify for Medicaid, and we're going to talk about the qualifications in this video, okay? So you can have one house and you can have one car when it comes to resources. However, you do need to stay in the guidelines of the income requirements. And I'm going to go ahead and hop into my computer and share with you guys what are the income requirements for Medicaid. So we're going to go over the three levels of Medicaid, okay? We have QMB, SLLMB, and QI. QMB is the highest level of Medicaid. If you get the highest level of Medicaid, remember where we talked about Medicare Part B premium? Well, Medicaid will actually pay your Part B premium for you. So any level of Medicaid, your Part B premium will be paid. However, if you get the highest level of Medicaid, which is QMB, it also pays what Medicare does not pay. So it will pay your deductibles, your co-payments, and your co-insurance, okay? So it will basically follow the services that Medicare provides. So if you have any co-pays or co-insurance from Medicare, Medicaid will actually pick up those co-payments. So this is what makes having both Medicare and Medicaid so powerful. Did you know that if you have the highest level of Medicaid, which is QMB, your doctor cannot charge you for any services related to Medicare? So if your doctor is sending you a bill, you can actually let your doctor know, hey, I have QMB level of Medicaid. You need to go ahead and bill this to Medicaid and not me. So that is something that you really need to understand. If you have the highest level of Medicaid, your doctor should not be charging you. They should not be sending you a bill at all. Now let's talk about the income requirements for each level of Medicaid. We're going to start with QMB. This is your Qualified Medicare Beneficiary Program. As an individual, you cannot make more than $1,275 per month. Your income resource cannot be more than $9,430. This means you cannot have more than $9,430 in your bank account or your savings account. Retirement account, you cannot have more than this amount. As a married couple, you can make $1,724 per month. Your resource limit cannot be more than $14,130. Let's talk about the second level of Medicaid, which is your SLLMB. This is your Specified Low-Income Medicare Beneficiary Program. As an individual, you cannot make more than $1,526 per month. Your resource limit cannot be more than $9,430. As a married couple, you cannot make more than $2,064 a month. Your resource limit cannot be more than $14,130. The last program we're going to talk about is our QI program. This is your Qualifying Individual Program. As an individual, you cannot make more than $1,715 per month. Your resource limit cannot be more than $9,430. As a married couple, you cannot make more than $2,320 per month. For your resource limit, you cannot have more than $14,130 in your bank account. Alrighty, so we talked about the income requirements when it comes to Medicaid. Now let's talk about the actual Medicaid application. So when you fill out the Medicaid application, it's very important that you check these boxes. You need to check all of these boxes to actually apply for the program. So you're going to definitely check the box where it says Medicaid, okay? You're also going to check these boxes as well. You're going to check medical assistance for the aged, blind, or disabled. You're also going to check the Medicare Savings Program. The Medicare Savings Program is what actually helps you not pay for Medicare Part B. So remember, you have to check these boxes. Medicaid is the first box you're going to check. You're also going to check for the age, blind, or disabled. So the age meaning you're over the age of 65. And then, of course, if you're disabled, then you're going to check the third box, which is the Medicare Savings Program. Don't forget to check all three boxes when you do the Medicaid application. Let's talk about long-term care for 1 second, okay? It's very important to note that Medicare does not cover long-term care. Long-term care is for individuals that need assistance long-term, such as they need help with eating, bathing, dressing, getting in and out of bed. They need help with everyday, day-to-day activities. Medicare does not cover long-term care. However, Medicaid covers long-term care. So you need to apply for long-term care Medicaid if you need assistance with long-term care, because like we said, Medicare does not cover long-term care. However, Medicare does cover skilled nursing services. So what is skilled nursing services? Skilled nursing services is services that is needed to be done by a skilled nurse, such as IV therapy medications, if you need therapy, such as a therapist helping you to get stronger and things like that. That's skilled nursing care, totally different from long-term care. So I just wanted to add that in today's video. Okay, so we talked about the qualifications for Medicare, and we talked about the qualifications for Medicaid. Now let's talk about the power of having both, okay? So the power of having both is, number one, Medicaid will pay your Part B premium for you. And that puts you in a category where most of your co-pays are actually going to be zero, okay? That is a great thing. Also, when you get on a Medicare Advantage plan, you have to have Medicare Part A and Medicare Part B to get on a Medicare Advantage plan, which is also known as Medicare Part C. A lot of times, depending on your zip code, I always say this, depending on your zip code in your state, you can get extra perks, okay? So you have Medicaid that's going to help pay your co-pays, right? And then you get extra perks as well for having Medicare and Medicaid. These are called Medicare Advantage dual plans, dual special needs, meaning that you have both Medicare and Medicaid. That's why they call it dual, okay? So these Medicare Advantage plans with dual special needs give you extra perks, such as allowing you to buy healthy groceries every month, okay? Transportation, more dental, vision, and hearing benefits. The extra benefits can be determined by different plans. Different plans offer different benefits. For example, you may get more over the counter for a certain plan that is a dual plan, okay? More transportation. You may even be able to use your health insurance card for rent assistance, to pay your electric bill, like I said, healthy foods, and more. It depends on the plan in your particular area. Okay, guys, I hope I made it crispy clear when it comes to having both Medicare and Medicaid, the power of having both, and the qualifications. If you need any assistance, our office would be more than happy to assist. Give our office a call. This is what we do. We'll be more than happy to help. If you like this video, please give it a big thumbs up. Share this video with a friend that may need this information. Thank you so much for watching. Don't forget to subscribe, and I'll see you on the next video. Bye.